Have you ever felt that something was slightly off, but not enough to name it or worry out loud? A little more confusion than usual, a pause before a familiar word, a kind of tiredness that did not feel like ordinary aging. One of my patients once shared this with me. She said, "Doctor, I thought I was just slowing down. I didn't want to bother anyone." What she was really describing was not fear or pain, but silence. And silence, in my years of caring for older adults, is often where important warning signs hide. I want you to imagine this for a moment. A brain that has carried memories, routines, and relationships for decades begins to feel a quiet strain. Not dramatic, not alarming, just subtle changes that are easy to explain away. I am Dr. Evelyn Carter, and on Senior Health Daily, my goal is to help you feel safe, informed, and respected as your body changes with time. Today, we are talking about Nipah virus warning signs that doctors rarely explain, not to create worry, but to bring clarity and calm understanding. Nipah virus is rare, and that is important to say clearly. But when it affects the brain, it often does so quietly. In older adults, early signs are rarely sudden or obvious. They are small shifts in attention, emotional presence, reaction time, or sleep patterns. From a medical perspective, this happens because viral inflammation can affect brain tissue before the rest of the body shows clear illness. When the brain is under stress, thinking and awareness may change first. What concerns me most is not panic, but patience taken too far. Many seniors assume these changes are simply part of aging. Family members notice something different, but hesitate to speak. This is why gentle awareness matters. Learning these signs is an act of care and dignity, not fear. If this conversation feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating calm, trustworthy guidance, made especially for you. In the next part, I will walk you through how the brain signals distress in ways that are easy to miss, and how to respond with patience, routine, and emotional safety. Why doctors often miss early warning signs. Why do early warning signs so often go unnoticed, even in caring medical settings? I have asked myself this question many times over the years, usually after sitting beside an older patient who wished someone had recognized the changes sooner. The truth is that early neurological changes rarely announce themselves clearly. They arrive quietly, wearing the familiar mask of aging. As we grow older, it is normal for reaction time to slow, for names to slip away, for energy to rise and fall. Because of this, subtle changes are easy to explain away. A senior may pause longer before answering a question, forget an appointment, or seem less emotionally present. Family members often tell me they assumed it was stress or fatigue. Doctors may see these moments during a short visit and think the same. Nothing looks urgent. Nothing feels dramatic. In my caregiving experience, the brain under viral stress does not behave loudly at first. It whispers. A patient once told me she felt as if her thoughts were wrapped in cotton. She could still function, still smile, still follow routine, but something felt slightly out of reach. Her family noticed she slept more and spoke less, but no one felt certain enough to raise concern. By the time she arrived at the hospital, those early signals had already progressed. Science helps us understand why this happens. When a virus affects the brain, inflammation can begin before fever or pain appear. The areas responsible for attention, awareness, and emotional regulation are often affected early. In older adults, the brain is already working harder to maintain balance. Even mild inflammation can tip that balance without obvious warning. Another reason signs are missed is emotional restraint. Many seniors do not want to worry their families. They are proud of their independence. They minimize their experiences, saying they are fine when they are unsure. I respect that dignity deeply, but it can create dangerous silence. Doctors also face limitations. Appointments are brief. Symptoms come and go. Without clear red flags, it is easy to focus on the most common explanations. This is not neglect. It is the reality of how quietly neurological changes can blend into everyday life. What matters most is learning to listen differently, not with fear, but with patience. When small changes persist, when routine feels harder, when awareness seems dulled rather than simply tired, those moments deserve attention. Early recognition is not about labeling or panic. It is about protecting the brain with the same care we give the heart and body. How Nipah virus affects the brain. When we talk about how Nipah virus affects the brain, I want to begin by easing one common misunderstanding. Serious brain changes do not always come with sharp pain or dramatic symptoms. In many older adults, the brain can be under stress long before the body signals distress in obvious ways. The brain is protected by layers designed to keep infection out, but certain viruses, including Nipah virus, can cross those barriers and reach brain tissue. When that happens, the immune system responds by creating inflammation. Inflammation is not an enemy. It is the body trying to protect itself. But inside the brain, even mild swelling can interfere with how cells communicate. I often explain this to families by comparing the brain to a carefully timed orchestra. Each section must stay in rhythm for clarity, memory, balance, and awareness to feel normal. She called. Inflammation disrupts that rhythm. Signals slow down. Messages arrive late or unclear. The result may look like confusion, unusual sleepiness, emotional withdrawal, or delayed responses. None of this has to hurt. That is why it can be missed. In older adults, the brain already works harder to maintain stability. Blood flow changes with age. Nerve connections may not recover as quickly. So when inflammation appears, even quietly, the effects can feel larger. Consciousness does not suddenly disappear. It fades. Attention drifts. Awareness feels dimmer. A person may still recognize loved ones, but struggle to stay fully present. What makes this especially challenging is that pain is often absent. Many people expect illness to hurt. When it does not, they assume nothing serious is happening. I have cared for patients who felt no headache at all, yet their thinking slowed noticeably. Their families sensed something different, but could not point to a clear symptom. From a medical standpoint, this quiet disruption is why doctors monitor brain function closely when Nipah virus is suspected. Changes in alertness and awareness tell us more than pain ever could. These signs are not signs of weakness or failure. They are signals asking for care. Understanding this helps remove fear. The brain is not breaking, it is responding. With calm observation, routine, and timely medical attention, we can support the brain through stress. Respecting these subtle changes is an act of dignity. It allows older adults to be seen, heard, and protected before confusion deepens into something harder to reverse. Subtle mental and emotional changes. Some of the most important warning signs I have seen over the years are not physical at all. They live in the quiet spaces of behavior, mood, and emotional presence. These changes can be subtle, and because they unfold slowly, they are often misunderstood or overlooked. Confusion does not always look like disorientation. In many older adults, it shows up as hesitation. A person may take longer to follow a conversation or lose their place more often. They may repeat a question not because they forgot the answer, but because the brain is struggling to keep information organized. These moments are easy to excuse as normal aging, yet when they appear more frequently or feel different in quality, they deserve attention. Personality shifts can be even harder to recognize. A warm and engaged person may become quieter or less expressive. Someone who once enjoyed conversation may withdraw without explanation. Families sometimes describe this as a loss of spark. I gently remind them that the spark is still there. It is simply harder for the brain to express it when under stress. Emotional flattening is another quiet signal. This does not mean sadness or depression. It often looks like reduced emotional response. Laughter fades. Concern seems muted. The person is present, but less emotionally connected. In viral brain stress, this happens because the areas that regulate emotion are affected by inflammation. The feeling world becomes harder to access, even though the person inside remains whole. Withdrawal is often mistaken for choice. In reality, it can be a form of self-protection. When thinking becomes tiring, social interaction can feel overwhelming. Stepping back is not rejection. It is the brain conserving energy. This is why judgment is so harmful in these moments. Labeling someone as lazy, uninterested, or stubborn only deepens isolation. In my practice, I encourage families to observe with kindness. Notice patterns rather than single moments. Ask gentle questions. Maintain routine and familiarity. Speak slowly and clearly. Most importantly, protect dignity. These changes are not a loss of self. They are signals of a brain asking for support. When we respond with patience rather than pressure, we preserve trust. And trust allows early care to happen. Quiet observation, paired with respect, is one of the most powerful tools we have in protecting senior brain health. Changes in sleep, awareness, and balance. One of the earliest clues that the brain may be under stress often appears in daily rhythm. Sleep changes, awareness shifts, and balance becomes less steady. These signs are easy to dismiss, especially in later life, when rest patterns naturally change. But when they arrive together or feel unfamiliar, they deserve gentle attention. Unusual drowsiness is one of the most common signs I hear families describe. This is not simply enjoying an afternoon nap. It is a deeper heaviness. A person may seem hard to fully wake, drift off during conversation, or struggle to stay alert during activities they once enjoyed. I have seen patients who slept longer hours yet woke feeling no more refreshed. When the brain is inflamed, staying awake can require more effort than the body can comfortably give. Awareness can also narrow. Seniors may seem less tuned in to what is happening around them. They might miss cues in conversation or take longer to respond when spoken to. This is not rudeness or disinterest. It is the brain processing information more slowly. In viral stress, the pathways that support alertness can be affected without causing pain or visible illness. Balance changes are another quiet signal. A person may feel slightly unsteady when standing up or turning. Walking may become cautious, not because of muscle weakness, but because the brain is less certain about spatial awareness. Families sometimes tell me they noticed more hand-reaching for furniture or hesitation on familiar steps. These moments are often brushed off as stiffness or fear of falling, yet they can reflect early neurological strain. What makes these signs challenging is their subtlety. None of them announce an emergency on their own, but together they form a pattern. In older adults, the brain and body rely on routine to stay balanced. When that balance feels harder to maintain, it is worth paying attention. I encourage observation without alarm. Keep daily routines steady. Ensure hydration, nutrition, and rest. Notice whether changes persist rather than focusing on a single day. Speak calmly and allow extra time for movement and response. These small accommodations support dignity and reduce stress on the brain. Recognizing changes in sleep, awareness, and balance is not about assuming the worst. It is about listening carefully. When we notice early and respond with patience, we give the aging brain its best chance to recover and remain connected to the life it knows. When confusion becomes dangerous, there is a point where quiet confusion deserves closer care, not because something frightening is happening, but because the brain is asking for support it can no longer manage on its own. I want to talk about this gently because understanding this progression helps families act with calm rather than panic. When brain inflammation is mild, the signs can remain subtle for some time. Confusion comes and goes. Awareness fades and returns. A person may seem present one moment and distant the next. If inflammation continues without rest or medical attention, those windows of clarity can slowly narrow. This does not happen suddenly in most older adults. It is usually gradual, like a dimmer switch being turned down little by little. Loss of consciousness is not the first step. Before that, families often notice longer periods of unresponsiveness. A loved one may sleep deeply and be difficult to wake. When awake, they may struggle to stay focused or follow simple conversation. Speech can slow or become sparse. These are signs that the brain is working harder than it should to maintain alertness. From a medical perspective, ongoing inflammation can interfere with the brain's ability to regulate awareness. The systems that keep us awake, oriented, and responsive become strained. This is not a failure of the person. It is a biological response. When the brain cannot restore balance on its own, it may retreat into deeper rest. In severe cases, this can lead to coma. I want to be clear and reassuring here. Coma is not a sudden collapse in most cases involving viral brain stress in seniors. It is usually preceded by many small signals. That is why early observation matters so much. Responding early often means treatment can begin before consciousness is deeply affected. What I have learned at the bedside is that families often blame themselves for missing something. I gently remind them that these changes can look like exhaustion, aging, or emotional withdrawal. No one ignores danger on purpose. What matters is noticing when confusion feels different in quality, not just quantity. When confusion deepens, calm action is key. Medical evaluation provides information and guidance. Familiar voices, gentle touch, and consistent routine help the brain feel safe. Even when awareness fades, emotional presence still matters. Understanding this progression is not meant to alarm you. It is meant to replace uncertainty with clarity. When we recognize how the brain signals distress, we can respond with dignity, patience, and timely care. That response protects not only physical health, but the emotional safety every older adult deserves. Before we continue, I want to pause for a moment and speak to you not just as a doctor, but as someone who has spent decades sitting beside older adults and their families in moments of uncertainty. Conversations like this are not easy. They ask you to pay attention to subtle changes, to trust your observations, and to stay emotionally present even when answers are not immediate. That takes courage and care. Many seniors I have worked with tell me they feel relieved simply hearing that their experiences are real and worthy of attention. They are not imagining things. They are not being difficult. Their bodies and brains are communicating in quieter ways, and learning how to listen is a form of self-respect. Caregivers often feel the same relief when they realize that patience and observation are powerful tools, not signs of inaction. This space we are sharing right now is meant to feel steady and supportive. Senior health conversations should never rush you or make you feel small. They should give you language, confidence, and calm guidance so you can move forward without fear. That is the heart of this channel and the reason these discussions exist. I am deeply grateful that you are here, taking the time to learn and reflect. If this video has helped you feel more grounded or better informed, I want you to know that your presence matters. Building a community where older adults feel safe, respected, and understood takes all of us. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Sharing this information is not about numbers or popularity. It is about reaching someone who may be quietly noticing changes and wondering if they are alone. It is about giving families the confidence to observe with kindness instead of judgment. When you engage with this channel, you help keep these conversations gentle and accessible for others who need them. As we move forward, remember that awareness does not require urgency. It asks only for attention, patience, and care. You are doing something meaningful by being here, and I'm honored to walk through this information with you. Nipah Virus encephalitis. Explained simply. When people hear the word encephalitis, it can sound frightening and unfamiliar. I want to gently simplify it because understanding removes much of the fear. Encephalitis simply means inflammation of the brain. It does not describe how severe the condition is, and it does not predict the outcome. It describes a process, the brain reacting to something that does not belong there. In the case of Nipah virus, encephalitis happens when the virus reaches brain tissue and the immune system responds. The immune system's job is to protect us, but inside the brain, that protective response can cause swelling. Even mild swelling can interfere with how brain cells communicate. That interference affects thinking, awareness, balance, and emotional regulation. Many people expect brain illness to cause sharp pain or dramatic symptoms. Encephalitis often does not. Especially in older adults, it may show itself as confusion, deep fatigue, slowed thinking, or emotional quietness. These changes are not signs of weakness. They are signs of a brain working under strain. Seniors are more vulnerable to this process for several reasons. As we age, the brain becomes less flexible in how it responds to stress. Blood flow may not adjust as quickly. Recovery takes more time. The immune system can be slower to recognize and control inflammation. All of this means that even a modest viral impact can feel heavier to the aging brain. I have cared for many older patients who did not feel sick in the way they expected. They were not in pain. They did not have strong fever. What they felt was foggy, disconnected, or unusually tired. Families sometimes told me they felt like the person was still there, but slightly out of reach. That description is very accurate. Another important factor is routine. The senior brain relies deeply on familiar patterns to stay oriented. Encephalitis disrupts that sense of rhythm. Tasks that were once automatic require effort. Conversation feels tiring. This is why maintaining routine and calm surroundings becomes so important during illness. What I want you to hear clearly is this. Encephalitis is not a judgment. It is not a sentence. It is a condition that deserves care, patience, and medical attention. When recognized early, the brain often responds well to support. Understanding encephalitis allows families to respond with compassion rather than fear. It reminds us to slow down, reduce stimulation, and offer reassurance. The brain heals best when it feels safe. For seniors, dignity matters deeply. Explaining what is happening in simple terms helps preserve trust. It allows older adults to remain partners in their care, not passive observers. When we respect the brain's vulnerability, we also honor the life it carries. Why seniors experience stronger effects? As we grow older, our bodies change in ways that are quiet and gradual. The brain is no exception. These changes are not failures. They are signs of a lifetime of work, adaptation, and resilience. But they do mean that when stress appears, including viral stress, the effects can feel stronger and last longer. An aging brain works harder to maintain balance. Nerve connections may not recover as quickly as they once did. Blood flow adjusts more slowly. Chemical signals that support alertness and memory take longer to settle back into rhythm. When inflammation enters the picture, even briefly, the brain has less reserve to draw from. This is why symptoms can appear more noticeable in older adults, even when the illness itself seems mild. The immune system also changes with age. It does not respond in the same swift way it did decades earlier. Sometimes it reacts more slowly. Other times, it stays activated longer than needed. In the brain, this prolonged immune response can mean inflammation lingers. Lingering inflammation keeps the brain under strain, affecting awareness, sleep, and emotional regulation. I often explain this to families by saying that the senior brain values calm. It thrives on routine, predictability, and emotional safety. When illness disrupts those elements, the brain must work even harder just to feel oriented. This is why early care matters so much later in life. The sooner the brain is supported, the easier it is to restore balance. Early care does not always mean aggressive treatment. It often means observation, hydration, rest, and medical guidance before confusion deepens. It means adjusting expectations and allowing more time for recovery. I have seen older adults regain clarity simply because their families recognized change early and responded with patience instead of pressure. Another reason seniors experience stronger effects is that symptoms are often layered on top of existing conditions. Mild memory issues, hearing loss, or mobility challenges can amplify the impact of brain inflammation. What might feel manageable in isolation becomes overwhelming when combined. This is not something to feel discouraged about. It is a reminder of how valuable early awareness is. Acting early honors the aging brain. It gives it the support it needs before stress becomes exhaustion. In my years of caregiving, I have learned that the goal is not to return the brain to how it once was. The goal is to protect how it works now. Early care preserves dignity. It allows older adults to stay engaged, understood, and emotionally safe during illness. When we recognize why seniors experience stronger effects, we also understand why calm attention matters more than urgency. The aging brain responds best to respect, consistency, and timely support. That understanding changes how we care, and it changes outcomes. What families should watch for families often ask me what they should be watching for, and I always begin with reassurance. You do not need to become a medical expert. You only need to become a gentle observer. The people who notice early changes most accurately are those who share daily life, routine, and conversation with the person they love. What matters most is noticing change over time, rather than reacting to a single moment. Everyone has an off day. Everyone forgets a word or feels tired now and then. What deserves attention is when those moments begin to feel different in quality or frequency. Confusion that lingers, awareness that seems dimmer than usual, a loved one who is present, yet harder to fully reach. Watch how your family member moves through their day. Are familiar routines suddenly exhausting? Does it take more effort to follow a simple conversation? Are responses slower or less connected? These signs are not dramatic, but they are meaningful when they persist. Communication is just as important as observation. Speak calmly and directly. Ask open questions without pressure. Instead of correcting or rushing, offer time and reassurance. A gentle tone helps the brain feel safe, which often improves clarity on its own. Avoid arguing about what is real or remembered. Focus instead on comfort and connection. Sleep changes also deserve attention. Notice if your loved one is sleeping far more than usual or seems difficult to fully awaken. Watch for moments of deep drowsiness that interrupt normal activities. These signs are not always about rest. They can reflect changes in brain alertness. Balance and safety matter as well. Increased unsteadiness, hesitation when standing, or frequent reaching for support can signal neurological strain. These changes may appear before any complaint is voiced. Knowing when to seek medical help does not require urgency or fear. It requires trust in your instincts. If confusion is worsening, if responsiveness decreases, if speech becomes sparse, or if awareness fades for longer periods, medical evaluation is appropriate. Seeking guidance early is an act of care, not overreaction. I also want families to release self-blame. Many people tell me they worry they waited too long. Please remember that these changes are quiet by nature. You respond when you can name them. That is enough. Above all, protect dignity. Speak to your loved one, not around them. Explain what is happening in simple terms. Keep routine steady. Familiar faces, familiar sounds, and familiar timing provide deep comfort to the aging brain. Families play a powerful role in early care, not by fixing or diagnosing, but by noticing with kindness. Calm observation and respectful communication create a bridge between uncertainty and support. That bridge makes all the difference. Protecting emotional safety during illness. When the brain is under stress, emotional safety becomes just as important as medical care. I have seen many older adults regain clarity not because treatment changed overnight, but because the environment around them became calmer and more predictable. The brain heals best when it feels safe. Reassurance begins with presence. A steady voice, a familiar face, and a gentle pace can ease confusion more than repeated explanations. Even when awareness fades, the emotional centers of the brain often remain receptive. Sitting nearby, speaking softly, and maintaining eye contact communicates safety in ways words alone cannot. This is not about constant talking. It is about calm companionship. Routine is another powerful anchor. The aging brain relies on patterns to stay oriented. Keeping regular times for waking, meals, rest, and sleep helps restore a sense of order when internal signals feel unreliable. Small rituals matter. Morning light by the window, a familiar song, a favorite blanket. These cues remind the brain where it is and who it belongs to. Familiar voices carry special weight. I often encourage families to speak even when they are unsure if their loved one fully understands. Hearing a known voice can reduce agitation and help maintain connection. Speak slowly. Use simple sentences. Say the person's name. Reassure them of where they are and that they are not alone. Avoid correcting or testing memory. Emotional safety grows when pressure is removed. Reducing fear also means managing stimulation. Bright lights, loud sounds, and busy environments can overwhelm a brain already working hard. A quieter space allows the nervous system to settle. Limit interruptions. Turn off unnecessary noise. Soft lighting and gentle touch can help regulate awareness. I want to emphasize that emotional safety does not mean pretending everything is fine. It means meeting reality with calm honesty. Explain what is happening in simple, respectful language. Let your loved one know that care is being given and that rest is allowed. Fear often comes from uncertainty. Gentle explanation reduces that burden. For caregivers, emotional safety includes caring for yourself as well. A calm caregiver helps create a calm environment. Take breaks. Ask for support. You do not need to hold everything alone. Your steadiness matters, but so does your well-being. Illness can make older adults feel vulnerable and dependent in ways that are deeply uncomfortable. Protecting emotional safety preserves dignity. It reminds them they are still valued, still respected, and still themselves, even when expression is limited. In my years of practice, I have learned that healing is not only about what we do medically, it is also about how we show up. Reassurance, routine, and familiar connection create a foundation where the brain can rest and recover. That foundation is a form of care every older adult deserves. As we come to the end of this conversation, I want to slow everything down with you. If you are listening quietly, breathing a little easier, that is already enough. Knowledge, when offered with care, is not a burden. It is one of the gentlest forms of protection we can give ourselves as we age. Learning about conditions like Nipah virus is not meant to place worry on your shoulders. Awareness does not mean danger is close. It means your body and mind are being listened to with respect. It means small changes are no longer ignored or dismissed. From my years beside older patients, I have learned that the brain responds best when it feels seen, not rushed, and never judged. The aging mind carries decades of experience, memory, and resilience. It deserves patience. When we respond to health information with calm understanding instead of urgency, we give the nervous system room to settle. Healing is supported not only by medicine, but by trust. Trust in your body's signals. Trust in thoughtful medical care. Trust in your own ability to notice and respond gently. I often remind my patients to thank their bodies, even in moments of uncertainty. The body speaks because it is trying to protect you. Listening is an act of gratitude. Slowing down is an act of wisdom. There is no need to remember every detail you heard today. Simply understanding the direction is enough. If at any point health information feels heavy or overwhelming, I want you to remember this space. Senior Health Daily is not a place of pressure or fear. It is a steady place to return when you want calm guidance, reassurance, and respect for the life you have lived. Thank you for spending this time with me. Your presence here matters more than you may realize, and whenever you need a quiet voice, a patient explanation, or a reminder that you are not alone, Senior Health Daily will be here for you.